So there is a new measles case in a new state this morning to talk about. Health officials in Pennsylvania sounding alarm after the first confirmed case of the disease there. And they're now contact tracing after the unvaccinated child in Montgomery County got sick. Officials say that the child recently did travel through New York's JFK airport. So this new case comes as the ongoing measles outbreak in Texas is getting worse. Now up to 146 confirmed cases across 9 counties. One child has died there. At least 20 people have been hospitalized, and most of the cases in Texas are among children. Joining us right now is Dr. Megan Ranney, the Dean of Yale's School of Public Health. It's good to see you again, Doctor. Thank you for coming in. We have this outbreak in Texas that we have been tracking, and it is getting worse. Now we have a new case now confirmed in Pennsylvania. What do you see in this outbreak, where it stands right now?
It's too early to say whether that case in Pennsylvania is one of the random cases that we see every year where there's an unvaccinated kid who's exposed to a traveler who's also unvaccinated, and whether that case in Pennsylvania is just going to stop because the people in the community around them are vaccinated, real herd immunity, or whether the case in Pennsylvania is a canary in a coal mine for the spreading of this Texas outbreak far beyond Texas and New Mexico to the rest of the United States. You know, I and other physicians and public health experts are concerned, Kate, because our level of measles vaccination in kids in the United States has dropped below the level that we need to protect our communities, meaning that the outbreak that we've seen in Texas could be a spark to a fire across the United States.
And what is happening, if we focus in on Texas especially, is a classic case of why public health matters, and a coordinated public health effort matters so much to contain and stop something before it becomes an outbreak that we're seeing now. The controversial now Secretary of Health and Human Services, RFK Jr., he faced backlash last week for essentially shoulder shrugging about this outbreak, saying that it was not unusual, but also not taking the opportunity when asked about it to push people to make sure that their kids are vaccinated. He's now, I'll get your take, because he now seems to be taking a step closer, I guess, to maybe promoting getting measles vaccinations. He wrote an opinion piece that was just put out overnight saying this: the decision to vaccinate is a personal one, he wrote. Vaccines not only protect individual children from measles, but also contribute to community immunity, protecting those who are unable to be vaccinated due to medical reasons. What do you think of his messaging?
I would have preferred to see messaging that came out very clearly to say that the measles vaccine is one of the vaccines that has been most studied in the history of the world. It is tremendously safe, and it is unbelievably effective. And that if you are not vaccinated, and you live in Texas, or as we've now seen in Pennsylvania elsewhere, this is the moment to get yourself and your family vaccinated, not just for your child, who, if unvaccinated, if they catch measles, has a 1 in 5 chance of being hospitalized, a 1 in 1,000 chance of dying. So certainly get vaccinated for your kid, but also get vaccinated for your neighbor or grandmother with cancer, for your friend down the street who was unable to adequately respond to the measles vaccine, and for the babies who are not yet old enough to get measles. I would have loved to have seen that message, but as you say, the message that we got yesterday is better than what we heard last week.
One thing that we know, and you've noticed, you know this very well, is that childhood vaccination rates are on a decline, and you could say this is a result of that. I mean, with that being the case, what is next, do you think?
So there are 2 ways that this can go. So childhood vaccination rates are on the decline, but let's be clear that the vast majority of parents in the United States understand that vaccines are the safest way to prevent your children from diseases that used to kill kids in the United States. As a practicing emergency physician, I have personally watched the disappearance of diseases as we've developed vaccines. You know, I've been practicing for about 20 years. When I talk to doctors who are a bit older than me, they've seen disappearance of many more diseases thanks to great vaccination. And most parents understand that. Unfortunately, about 10 to 20% of parents are vaccine skeptical. I worry that we're going to have these kind of outbreaks to get folks to revaccinate their kids. I do understand those fears. I worry that they've been taken in by folks who are making a lot of money off of spreading lies and distrust. I hope that outbreaks like this can help convince folks and get them to do the research in the real scientific literature where we show so clearly how safe and effective these vaccines are.
And it is so sad that it would take something like this, an outbreak, a child dying from this outbreak, for people to wise up and learn the lessons here. But we are here, and in this moment, that is where we are. It's good to see you, doctor. Thank you for coming in.